Hello, my name is Walter Owens. I'm a social media officer at the World Health Organization. Today is World Blood Donor Day, which is a day dedicated to blood donors and their contribution to saving and improving lives. We may not often think about it, but every few seconds, someone in the world needs a blood transfusion. Without blood donors, this would not happen. Not all countries, though, have the same level of access to blood transfusions. So today is also a reminder that we need more blood donors to join the effort and give blood on a regular basis. With me today, we have Yuyun Marion-Gushi, team lead on blood safety. Hello, Yuyun.
Hello, Walter. Thank you for introducing me. Hello, everyone.
Maybe before I start asking questions to you, Yuyun, for our viewers on social media, you can ask questions regarding blood safety and the World Blood Donor Day at any time in the chat, and we will try to answer these as much as possible. So as a first question and as an introduction, Yuyun, could you tell me, is it safe to give blood during a pandemic like COVID-19?
Thank you, Walter, for your question. Before I answer the question, please allow me actually to say Happy World Blood Donor Day to all volunteer unpaid blood and plasma donors, and also to say thank you for your life-saving gifts that already save millions of lives. Okay, for your question, of course, I can say that it is safe to donate blood during this pandemic situation, as long as the blood centers and the blood donors follow the defined requirement. So as you know that the COVID-19 disease caused by SARS-CoV-2 virus can be transmitted through the droplets and air. So it is important for the blood centers and blood donors to do an effort to mitigate the transmission of this virus. For example, the blood centers need to regularly clean the environment. It is including the donor's waiting room, the blood collection rooms, the donor refreshment room, and also cleaning the high-touch area, such as the elevator buttons and also the doors knobs. And also they need to provide the alcohol-based hand rub and also the mask, and of course also the lidded trash bins. So whenever the used tissue or used mask is not needed, then they can easily be discarded. And of course, social distancing also need to be implemented by these blood centers as far as possible in all rooms that mostly occupied by the blood donors and the blood center staff. And another way is also the blood center staff need to wear the personal protective equipment, such as hand gloves, while they are collecting the blood, and also wear the mask at all times, as well as blood donors. Also, it is needed for them to wear the mask at all times. And another important thing is actually to maintain the ventilation, so to allow the exchange of air in the room appropriately. And then blood center also should ensure that the pre-donation criteria and donor questionnaire are able to exclude any symptomatic individuals. So you will find on the donor questionnaire that there will be a question asking about the travel history and also asking about the contact history to the COVID-19 patient or to the COVID suspects people. And for blood donor, actually, we also need to educate them adequately on the risk factor for self-deferral. So then the donor will understand, for example, if they feel that they have a fever or they have a respiratory tract symptoms, then they will defer themselves not to donate the blood and not to enter the blood center's venue. And also maybe another advice is needed that if someone would like to donate blood, yeah, they better not to come in a big group, and then also not to be accompanied by other person, not to talk too much, and also not to gather in the room during the blood donation activity. So indeed, by implementing this situation, I think it's safe to donate blood during the pandemic. Thank you.
Okay. So as long as you take extra precautions, you're fine giving blood even during COVID-19?
Yes, indeed.
Okay. And for those who are watching on Twitter, you can ask questions using the hashtag AskWHO. And for people watching on LinkedIn and on Facebook, just leave a comment in the comment section. So off to the next question, Yoyun.
Yes.
What should a blood donation booth look like during COVID-19?
Okay, so again, considering that this virus can be transmitted through droplets and air, so it is important that an open and crowded blood donation booths should be avoided. So anyway, because of the lockdown policy, currently most of the mobile drive activity has already been canceled. And if this kind of activity for, the mobile drive activity need to be done, so it should be planned as careful as possible. So all the requirement that I mentioned before also need to be implemented during this mobile drive activity. And maybe limiting the number of donors in one activity of blood donation and limiting the number of staff is also needed. Social distancing also needed. So we need a large area, so then we can put enough distance between donor chair. So everything that implemented in the blood collection venue should also implemented during the blood donation booth. Thank you.
Yes. So today is World Blood Donor Day, like every year on the 14th of June. Would you like telling us a bit more about what Blood Donor Day actually is and what we're doing on that day?
Yeah. Okay, so what Blood Donor Days actually is an event that serves to thank voluntary, unpaid, and regular blood and plasma donors. Again, for their life-saving gifts that saves millions of lives. But this event is also a chance for us to increase the awareness of population or community that on the need of donating blood regularly, because by having enough blood, then all individuals and community have a better access to safe blood supply. Thank you.
Okay. And for those people who might be interested to donate blood, is there any requirement that you have to fulfill to be able to be a blood donor?
Yes, of course. So everyone can donate the blood as long as all requirements are fulfilled. So the requirement can started from the age of the donor. So in general, most of the country apply the age of the donor between 18 to 65 years old. And then the second item is about the minimum body weight. So some countries apply 45 kg for taking 350 ml of whole blood, and other countries apply minimum body weight of 50 kg for taking 450 ml of whole blood. And of course, the blood donor should be in good health. So there is no infectious disease symptoms. There is no vital organ disorders such as lung disorders, liver disorders, heart disorders. And of course, there is also no high-risk behavior in this donor. And anyway, after this requirement fulfilled, again, the blood center will check the health of the donor by, for example, by having measurement of the body temperature, and then they also will take blood pressure measurement and also the hemoglobin level. And after all of these things, again, the important thing that is the donor should understand all the information provided, and then they also should give a consent that now they agree to donate the blood, and they also agree that some laboratory testing on infectious disease such as HIV, hepatitis B, hepatitis C, syphilis, and etc. will be done on the donated blood. So that is the requirement so far implemented in almost all countries. Thank you.
And I think there are different categories of blood donors. So some people do it voluntarily and are unpaid. Why is it important for blood donors to do it on a voluntary basis and do it on an unpaid basis?
Yeah, so blood is actually part of the human organ. And it is indeed called as a giant organ. And as well as donating human organ, so donating blood is also unethical if it is paid. And furthermore, voluntary blood donors usually will not lie about their health condition. In contrary, paid donors may hide the condition of their health because they donate blood for taking the benefit of it. And I think donating blood voluntarily, psychologically, will give a feeling of happiness, gratitude, and also satisfied that the blood that they donate save life. And maybe not only one life, could also save 2 to 3 life. And so then by having this kind of feeling, voluntary blood donor can encourage to repeat their donation. So that is why actually the voluntary blood donor is potential to become a regular or sustainable blood donor. And the blood come from this regular or sustainable donor is the safest blood, because this regular donor will have a medical check every 2 or 3 months, and also they will have the infectious disease screening.
Yes. So when you're talking about regular donors, how often can you do it? Is it something that you can do like once a week, or is it more often? Or obviously, if somebody's donating blood, you hope that that person goes back and donates as much as possible. So what's an ideal scenario for a regular donor?
Yeah, actually it depends on what kind of blood component is donated. So if somebody would like to donate whole blood, they can do the whole blood donation every 8 weeks or every 2 months. While if somebody would like to donate the thrombocyte or platelet, which is the tiny cells in the blood that can form clots and stop bleeding, they can donate this kind of component every 1 or every 2 weeks. As well as donating the plasma, which is the liquid part of blood, they can donate the plasma every 1 or every 2 weeks. But of course, there is a maximum number of donating this kind of component. For example, for donating the platelet or thrombocyte, a year they could only donate 24 times. And for plasma, a year they could only donate 33 times.
So it actually depends on the type of donation that you're giving.
Yeah, that is right. Yes.
Okay. So I think we will watch a short video in a moment, but first I would like to remind everybody who's watching on Facebook and on LinkedIn, if you have any questions regarding blood donations, blood transfusions, or the World Blood Donor Day, please leave a comment. If you're on LinkedIn, you can use the hashtag AskWHO. Or if you have already been a blood donor or regular blood donor and you would like to leave a comment motivating other people to do it also, please go ahead and write a comment in the section. I think we can watch a video now.
Mm-hmm.
And we're back, World Blood Donor Day. I'm still with our expert, Yuyun. I have a couple of questions that we received on social media. There are a lot of questions regarding the age. I know we talked about it previously, but could you please repeat what is the ideal age for a blood donor and which age group they should be?
Thank you for the question, Walter. So in general, most countries apply the range age of the donor between 18 years old to 65 years old. But indeed, some countries start to have a blood donor in the age of 16 or 17. So 16 or 17 is actually related to the permission from the parents. And 65 years old also it depends actually on the health of this donor. If the physician say that this donor is healthy enough, so more than 65 years old in some countries still allowed to be to become a donor.
Yes. And during COVID-19, I know we talked about this previously, but should the blood donor wear a mask and the person helping the blood donor? What are the safety precautions that should be kept in mind?
Yes, during COVID-19 pandemic, I repeat my statement before that crowded in the blood collection site should be avoided, and the donor should regularly clean their hands. And then as soon as, for example, if they sneeze or if they use the tissue, so this used tissue should be immediately discarded into the lidded trash bin. And wearing the mask all the time during the blood collection activity. And so also actually to avoid the crowded of people in the blood collection center, usually the blood collection center will advise the donor to make an appointment. So by having the appointment, it will avoid the waiting time, and also donor only stay for a short time in the donation room.
Yes. Okay. We have a question from Betty N. Egeomo, and she's who's asking, can a person with hypertension donate blood?
Sorry, can you repeat?
Can a person with hypertension donate blood?
Oh, hypertension. Okay. Yeah. So there is a requirement that for hypertension, it's better not to donate the blood because we afraid that this hypertension also has a relation with other disease, for example, related to heart disease. And especially when this person also take a regular medication. So this some medication used for the hypertension can affect the quality of blood. Okay.
And we have another question on LinkedIn. If you donate blood plasma, does it deplete your antibody levels in the future?
Yeah, as I mentioned that donating plasma can be done every week or every 2 weeks, but the maximum number a year is 33 times. So of course, the blood center will regularly measure the level of your protein and antibody. And when this level of protein and antibody is low and not fulfill the requirement, of course, then the blood center will advise for this donor not to donate the plasma.
Another question is, why is there currently a shortage of safe blood, especially in certain countries?
Yeah, actually, current data showed that almost, I think, more than 90 million units of blood was collected a year. But indeed, from the global database of blood safety to 2015, it shows that 70% of global donation was collected in medium to high income countries, which is a place for around 40% of global population, whereas the remaining 30% of global donation was collected by the low-income country, which is a place for almost 60% of global population. And not only the number of collection, but also the safety of blood is still cannot be guaranteed in low-income country because not all donated blood 100% tested toward the infectious disease. And what is the reason? So the main reason we found out is lack of education, and also there is some cultural resistance that affecting the willingness to donate blood voluntarily. So by lack of education, sometimes people start to fear of having venipuncture, or they are also fear to get the infections during blood donation, and some culture even prohibit somebody to donate for other people. Another problem that we found out is ineffective in donor recruitment. So for example, because there is a lack of government support, and then there is no public figure that give example of donating blood, and also there is no effective public campaign on this blood donation. And another problem, just yesterday, I asked my friend who has no experience at all in donating blood, and I asked him why. And he said to me, yeah, well, Yuyun, I need to spend almost 2 hours to go to the collection center to give the blood donation and then return back to my office. So that is too much. So, and then I asked, don't you know that you can make an appointment before you go to the blood center? So maybe this kind of information is also needed. And then also he said to me, and anyway, what is the benefit of donating blood? So that is why maybe those kind of information is also really needed to be spread among the community. And as I mentioned before, that public figure usually give a big effect, yeah, to the community. I remember in my country when the governor or the sub-district head give a donation, or some actress or actors give blood donation, then communities start to follow this activity. Thank you, Walter.
So this is why days like World Blood Donor Day are so important to raise awareness.
Yes, indeed.
And it's also interesting that you touched upon the point that sometimes people don't even know what it's for. And then sadly, only if an accident happened, for example, or they are in need or a loved one is in need, then they realize the importance of it. But obviously we need a continuous flow of blood donations to give the system going. Some good points. Thank you. There's an interesting question on LinkedIn. If a person was using antibiotics, should she wait after she's able to donate blood? Is there a certain time frame?
Yes, of course, because the physician giving antibiotic usually because there is an infection. For example, maybe this person have a bacterial infection, and if the bacteria is exists in the blood, of course, this bacterial can be transmitted to the patient. So indeed, this person need to finish the cure, taking this antibiotic, the whole dosage, and then also should wait until all the infectious symptoms gone. Then they can start to donate the blood.
We have a question from Lily April, who's asking, can a plasma donor give plasma to a person of different blood type?
Usually, even though plasma has already been separated from the cell part of the blood, but still in the plasma, small cell still exists. So indeed, giving the plasma still need to be given in the same blood type.
Yeah. Did the COVID-19 pandemic affect blood donations around the world? Has it become less than previous years is one of the questions.
Yes, I found out the information from our colleagues in almost in all regions. They said that this COVID pandemic impact into the decrease of the blood supply. Why? Because the lockdown policy prohibit everybody to go out from home. and then so less and less blood donors donate the blood. And the data shows that around 20 to 30% decrease of blood supply. But fortunately, the situation is not create a significant problem, because I heard that most of the hospital currently also focus to treat the COVID-19 disease, and almost all the elective surgery or medical procedures was also postponed.
Yeah, but here it's probably also important to stress that donating blood right now is still safe if you use the required safety measures that you mentioned previously. So people can still actually donate blood and help others
Yes.
when they need it. Could you maybe go through the different blood types and how this affects blood donations?
Mm-hmm. Okay, so the population in the world mostly have O blood group, and then the less blood group is AB. Mm-hmm. And then we also have a classification of blood group between rhesus negative and rhesus positive. So most of the population also has a rhesus negative. So in terms of ABO blood group and rhesus blood group, so the least type group blood group is AB rhesus negative. So if someone that has AB rhesus negative need blood, usually we have a little bit problem. So indeed the communication between blood centers is needed, and then we can ask if another blood centers have a blood supply in this kind of in this type of blood group, then they can send to the blood center that need this kind of blood type.
Yeah. We have a question from Anas Al-Jubur. What's the difference between plasma, serum, and whole blood?
Mm-hmm. Okay, so whole blood is the whole part of blood. So it consists of cells, which is the red cells, the thrombocyte, and also the white blood cells. While the plasma is the liquid part of the blood. And if you talk about plasma and serum, so actually the serum is loss of the anticoagulant. So it is still a liquid part of plasma, of blood, but has loss of the anticoagulant.
We have one question from Suriname relating to tattoos and blood donations. Does a tattoo affect the quality of blood of a donor, or is it a reason maybe not to give blood?
Yeah, so WHO guidelines still say that it is prohibit for the person who just have a tattoo to donate blood. So they have to wait for 3 to 6 months after the last tattoo. But anyway, currently more and more tattooing shops implement the hygiene and safety tattooing practice. So again, each country actually should review the risk potential of having infectious disease due to tattooing practice. For example, just this year I heard that Netherlands did the research, and from the research it shows that there is no potential risk of having infectious disease by having the transfusion from blood taken from the tattooing person. But then this research is limited to the tattooing activity done in Netherlands, in where almost all the tattooing shops in Netherlands is really strictly monitored, whether they already implement the hygiene and safety practice, and they also should register. So this kind of example, I mean, the regular research, regular epidemiology study will then change the deferral period from taking a blood from the tattooing person. Thank you.
We have a question on LinkedIn regarding individuals who have had COVID-19. So the question goes, if it's safe for them to donate blood after they had COVID-19.
Yeah, so actually now, because there is no drug of choice of COVID-19, and also vaccine is not yet founded, every country, and not every country, I mean more and more countries start to think of using the plasma taken from the recovered COVID-19 patient. And WHO actually recognized of using this kind of plasma, which is called as convalescent plasma, because in this convalescent plasma, the antibody to the virus is in there. But because there is no adequate or enough evidence on the efficacy of using convalescent plasma to treat COVID-19 patient, so using of this convalescent plasma should be under the clinical study. So the patient that get this convalescent plasma should be monitored whether there are adverse reaction of this from having this convalescent plasma. And also specific requirement is needed on which kind of COVID-19 patient that can donate the plasma.
We have a question from Pauline Williams Sylvester, who's asking, what is the blood count one should have prior to donating? Is there a blood count you should have prior to donating?
For the whole blood donation, actually, we just measure the hemoglobin level. Yeah. But for example, if you want to donate the platelet or thrombocyte, yes, this donor need to be to have a laboratory testing for to find out what is the thrombocyte count in their blood.
Okay. Thank you so much, Yuyun, for spending your time with us and answering the questions from social media. I think it's really important that anybody can donate blood and they should donate blood. And obviously World Blood Donor Day is a day where we thank everybody who has been donating blood, those who've been doing it regularly, and maybe also motivating those who have not donated blood yet, but they should really consider doing it regularly and help somebody. It only takes about 15 minutes and you can save many lives. So it's an investment that everybody should consider doing. And we had a lot of viewers from across the globe. So we had people from the USA, Saudi Arabia, China, Kenya, Uganda, Bangladesh, Ethiopia, Argentina, France, Egypt, Myanmar, Turkey, Colombia, Iraq, Angola, South Africa, Qatar, Mexico, Indonesia, and the list goes on. So we would like to thank everybody for watching. If you have been a blood donor previously, please go ahead and write what you thought about it, what your experience was. Try to motivate other people to donate their blood. And thank you so much for watching. And we hope to see you next time on our stream. Thank you so much.
Bye-bye. Thank you.